Thank you to everyone for joining our virtual press conference this morning to discuss the important role that face masks play in keeping our community safe from COVID-19. My name is Kathy Sell and I'm a marketing manager with Essentia Health. Joining us today is Dr. Rob Westing, Cuyuna Regional Medical Center's Chief Medical Officer, Dr. Peter Henry, Essentia Health's Chief Medical Officer, and Dr. Adrienne Moen, Family Medicine Provider at Lakewood Health Systems. To ask questions when they're done speaking, you can use the raise your hand function and wait to be called on, or you can submit them in the Q&A feature at the bottom of your screen. Please specify which media outlet you're with and to whom your question is directed. And we'll start this morning with Dr. Peter Henry.
Hello, everyone. Thanks for joining us today. My name is Pete Henry and Chief Medical Officer of Essentia Health, and I'd like to thank Dr. Westing and Dr. Moen for joining me here today. We're here to talk about the importance and effectiveness of wearing face masks to reduce the transmission of COVID-19 virus. And the evidence is becoming quite significant that we know that based on recent scientific and clinical studies, simple cloth face coverings, if worn broadly and used appropriately, have the potential to dramatically slow and spread the risk of COVID-19 and save thousands of lives. Wearing masks provides what's called source control. There was a recent report from the Wall Street Journal that stated in Hong Kong, a very densely populated country that's close to the population of New York City, had just 6 COVID-related deaths. And you compare that to New York City's almost 20,000 deaths. One reason for this disparity, Hong Kong had about a 97% compliance rate during rush hour for the use of their masks. Statistically speaking, the evidence is becoming quite clear, and consider the following. The University of Washington says that 95% compliance with mask use in the public could result in at least a 50% decline in transmission. And some studies that I've read actually show up to an 80% decrease in transmission. The Scientific Journal of Mathematical Biosciences goes even further, predicting that the high use of face masks in public could eradicate COVID-19. And that's because, as Dr. Amanda Nosk, who is one of our infectious disease physicians here at Essentia, says if you don't give the virus a way to transmit itself to another human being, it will die. It has to have a place to live. The Minnesota Department of Health reports that almost 8,000 cases statewide have no known source of infection. That's because close to half of everyone with COVID is asymptomatic. And the statistics that I've read is anywhere from 34 to 41% have it, but they don't know they have it, which underscores the importance of wearing a mask, especially when you're in public and in close proximity to others, because you don't know who does and who does not have COVID-19. It's important to point out that this is a significantly different virus than seasonal influenza. In a typical year, the World Health Organization estimates that about 1 billion people worldwide will have the flu, and about 290,000 to 650,000 of those people will die. And that's really less than 1 out of 1,000 contract influenza that actually die. In contrast to COVID-19, to date, about 13,100,000 to 200,000 people have tested positive for COVID-19 worldwide, and 573,000 have died. That's about a 4% risk of death, or about 2 out of 50. Significantly different than less than 1 out of 1,000. I'll stop there, but we could spend much of the time reviewing the data and the studies and the scientific evidence, but masks make a difference. And I think that's the key message we want to convey. They have been proven to protect us and protect others. And by wearing a mask, you're not making a political statement. You're making a statement that says, I care about others. Because that's really what masks do. They protect people who are around you. And if we all do our part by wearing masks and by practicing social distancing whenever possible, by constant hand washing, we can drastically lessen the threat of COVID-19 until the vaccine is available. That's still months away, which is really a sobering thought, but this public health crisis isn't close to being over. We're in it for the long haul, and so we must remain diligent and take these precautionary steps like wearing masks. This issue shouldn't divide us, it should unite us in a common cause to protect each other. One final thought before I turn it over to Dr. Westing and Dr. Moen, I just ask that everybody be smart. This is no time to get lax. So for yourselves, in this beautiful area we are blessed to live in and play in, please, if possible, limit the number of people you're around, wear a mask, especially if you're indoors, and wash your hands. And I'll turn it over to Dr. Westing. Thank you.
Thanks, Dr. Henry. I didn't know if we needed to all make general statements, but I would echo most of the information that Dr. Henry said there supports this sort of scientifically, it just supports it unequivocally. And it seems to me like it has become kind of a distracting thing in our world and in the country, especially, to say that this is more than just a common sense, uh, protect your neighbor, protect yourself, protect your family from this type of an infection that we haven't seen before. So we're just unaware of the dangers of it. But as we obviously have lived with it now for several months, it is a life-changing event, and we need to take it as such. So yeah, I think that the very simple things are the things that we've proven work with this, and the science behind it has been reiterated over and over again. I just heard another study again from Europe, from Germany, I think it was, where they implemented mask wearing community by community going across the country. And as they did that, they saw, similar to what Dr. Henry said, a 40 to 50% decrease in the risk of infection and the risk of spread, and therefore the risk of deaths from just the simple thing of wearing masks. So this is not rocket science. It's difficult to realize how important this is, but we're really doing it for the simple matter that it works. And so I just encourage everybody to carry that very simple message beyond just hearing it from us, but hearing it in your families and in your communities.
Yeah, I also just would reiterate the sentiment that, wearing the mask isn't necessarily about you or your beliefs or anyone else. It's really about protecting those that you love and care about and come in contact with from you. And so source masking has been shown time and time again in many, many studies that continue to come out that we can reduce the risk of transmission if we are all doing our part.
Thank you all for your comments. I open it up now to media to pose any questions that you may have on the topic. I don't see any hands raised at this point, but if you do have a question, you're free to raise your hand to add any questions to the conversation today.
I just want to make sure we're not having any audio problems, but I haven't seen anybody raise their hand yet, but we're more than happy to answer questions that anyone would have as to what our individual organizations are doing to help promote mask use.
I see Chantel with Lakeland TV is unmuted. Chantel, you have a question?
Yeah, one question I have is, how do you think schools, as they begin to open up in the fall, how do you think that they'll be able to effectively kind of make sure that everyone's wearing masks? I think that could be really hard for children for, 8 hours a day or 4 hours a day. How do you think that they'll be able to do that effectively?
Obviously, the communication piece, because there's a lot of pieces of communication besides just our spoken voice. There's a lot of facial recognition that talks about what we're saying and how we're saying it. But, use of masks in those settings is going to be very important as well. And, each facility is going to have to look at their classroom size, their ability to separate and distance people greater than at a minimum 3 feet or a meter. And then try to ensure compliance with masks as best they can. The cloth masks really are helping to decrease the spread to another individual. They don't necessarily prevent somebody from getting it, but they help reduce the spread. And we use in our facilities procedural or surgical masks that actually have a water barrier. But I think there are ways to develop and design programs that are individual to each school system in order to hopefully ensure mask compliance. The social distancing is hard because I don't think that every generation probably sees this as a significant threat as people in my generation per se do. And that piece of social distancing is probably as important or just as important as masking as well.
Yeah, I would agree. We're certainly not educators in the public school system, but these are common sense things. I think every school district should come up with a policy or look at all their policies regarding the interactions that the kids have in the classroom. Certainly social spacing is one of the things. Hand hygiene is very important. And obviously, I think that that's been emphasized over the years, but we need a heightened awareness of what that means as they share instruments for schooling, computers, different things like that. I think there'll be just a heightened awareness of hygiene with that. Will definitely improve this. The masking challenge, certainly as the younger the children get, the more it's going to be difficult for them to wear them. But I see children in my office wearing them all the time, families making it sort of a pick your favorite Marvel character, you know, what does your mask have to look like? I think there are different ways. The masks functionally do not have to be perfect. Certainly in healthcare, we're wearing the surgical masks, like Dr. Henry mentioned, because they have some added advantages for exposures. But the studies show that any kind of a face covering to reduce those droplets, reduce that aerosolizing, leaving the mouth of the wearer is the thing that reduces the transmission. So I think that schools could adopt that, and we're not expecting it to be, none of this is a perfect solution. I mean, what you're trying to do is reduce risk and reduce spread. And as we do that, if we reduce that number of patients or number of people that get infected from one person that might be carrying it, we generally are winning the battle with this virus. And so that's that's where I think that the message needs to be, is that anything is better than nothing, and doing some with the kids is better than not doing anything. And I think that as we open up, we just have to adopt some of those practices that have been proven, and recognize that parents can lead the way too. So focusing, I think, on the parents' education is a key part of it. And as long as we have buy-in and all that, I think we'll be able to safely do some of these things that we want to do.
Yeah, I would agree and reiterate that it really starts at the home, and making it normal for the kids now, for them to be wearing their masks when you're out and about, you know, even at home. I have my kids wearing them, you know, just for 10 minutes, so they start to get used to it, so that it's really not on all of our educators and our teachers. It really needs to start at home for the kids to get used to it.
I would just add one other thing, you know, as we see, or hopefully see, significant improvement in mask compliance in public settings and indoor settings, there's a secondary advantage. And we're talking about COVID-19, but we're also in the fall going to be approaching the influenza season. And when we get seasonal colds and viruses, we should see a significant drop in those instances of the transmission of those diseases, as well as a secondary positive side effect. You know, and influenza isn't a completely benign disease for every individual as well. So I think there are added social benefits to people using masks beyond just the COVID-19 as well.
And I would add on to that, I think too, Dr. Henry, that we are in healthcare, I think, are very concerned with those seasonal viruses that we know come every year, rearing their ugly head here now in the next few months, that this is going to be a real challenge for us to try and decipher what is COVID potentially as it comes into our area with more regularity, and what is the influenza, or what is a regular cold virus. And the more we can do to quell the spread of any of those viruses, the easier it's going to be on our healthcare providers and on our healthcare systems to care for all the patients that we need to see. And so definitely feel like the benefit is there to wear those masks. I mean, we've seen that worldwide. We've seen other countries doing that because they potentially have dealt with other more serious infections than the US has had to deal with previously. But this one now is raising the challenge for us, and I think we need to step up.
Thank you for all those great points. Do we have other questions for our providers today?
While we're waiting, I think people are always looking for what's a practical example of what does this mean, or, you know, how can we tell a story that might click with people? And one that I heard this last week that I think is real relevant for our area, maybe not so much now that we've gotten a couple rainstorms, but we had a pretty significant dry spell here earlier in the summer. And when you looked out, you see dry brown grass everywhere. just waiting for a lightning strike or waiting for somebody to drop a cigarette or a spark. And we have fire bans that we're all used to in that type of a scenario where we don't burn our normal brush fires. We don't light different things because we know that could potentially burn our own house down, but also light the fire that might potentially wipe out a town. I think that we're used to that concept. This is the same thing. We're basically dry grass waiting to be burned by this coronavirus. And if we don't protect that spark or that initial fire that's going to start somewhere, potentially we could be the one that ultimately hurts our own family or hurts our community. And I think that struck a chord with me. I think that it's seasonal, it's somewhat relevant to our area. I think that if we can use those type of examples to tell people this is not just because we think wearing a mask is fun, it certainly isn't, or wearing a mask is easy, because it certainly isn't, it's uncomfortable. But that type of thing where you actually are protecting your family, protecting your community, and we're used to having restrictions on our lives in other areas. We need to accept, like Dr. Henry said at the outset, this is not a political statement, this is practical. This is something that we don't have any other great ways to treat right now. The only way we can prevent it is to prevent that fire from starting, and that's really what we need to do. So I would just encourage people to, whatever examples you think click, but use them, because those are the things that will get people back to the reality of this, which is not a government takeover, not a political issue, but the practicality that this is a serious issue.
Thank you for that reminder. I think reality is this has been happening for a while, and this is a long haul, and fatigue sets in, and fatigue on following those best practices. So those reminders that can re-energize us to follow best practices are great. Thank you. Dr. Moen, anything from your end to add to that?
I don't think so, no. I think, yeah, I mean, like you said, the fatigue has set in definitely, and it's summer in the Brainerd Lakes area, and we all love to be outdoors and enjoying places, but we still need to be following the social distancing and masking as much as possible.
I think it is helpful to remember, though, that this is not a death sentence for anything enjoyable that we can do out of doors. We can be outside, we can be on a pontoon with a few people, we can distance. Certainly the transmission is much less in an open air environment, but just be wise. Don't share the bottle of water, don't get super close to each other, maybe a few less hugs and kisses with family than you normally do. Those are just wise things to do, because we just don't know where this virus is hanging out. And but at the same time, we do live in a beautiful area. We should be able to enjoy it, and people should be able to get out and do those type of things.
I just have one more question. As far as a medical perspective, is it better for most people, if they can, to continue to stay inside and just kind of refrain from being out in public? Or is it now okay and acceptable to kind of do both, but just make sure you're wearing masks?
Well, like I said, outdoor activities that are not crowded areas, no limitations, I would say. I mean, maybe the other can pipe in, but there's no risk of you transmitting an infection a quarter of a mile away to your neighbors. So get outside, walk down the street, do things like that. As far as going into public areas, if you're going to be within 6 feet of somebody during that time that interval that you're out in public, you should probably be wearing a mask to protect those people that you're going to be around. If you anticipate being in a close area, certainly that raises the risk, and that's where we're saying it's real important to try and minimize that and maintain the 6 foot distance that is recommended. Practice good hygiene with your hands. If you have any symptoms or any question of anybody else having symptoms, that should really limit your interaction with them or you going out. Those are just kind of common sense things, but those are the things that we see being very important. And obviously it's a challenge when you're opening up restaurants, opening up businesses. They're doing the best they can. A lot of businesses are doing a great job with that. I think that we can balance those two things out, but there are also a lot of people that want to just abandon all that and say, why even worry about it? We haven't seen, a case in our family, or we haven't seen a case in our community for a while. But that's somewhat short-sighted, because it's still out there. Just look at the paper, look at the news, and we need to be careful still.
I would echo Dr. Westeen's comments in that I think for each individual, the risk is different. Obviously, with advancing age and other significant medical conditions like diabetes, hypertension, heart disease, that person's risk is significantly different. And even though I have frequented or gone to specific businesses, I see some of them really good mask compliance and policies where they have the appropriate barriers in place. All the employees are masked, they clean the carts and do those type of things. If you look at individual performance, the use of masks, I see many people wearing a mask with their nose still exposed. I see them touching their mask very frequently without cleansing their hands. So I think people, as Rob said, need to really use common sense. If you are in a high-risk group and you have the necessity of going out, you should really frequent places that are adhering to those type of practices of social distancing, masking, and the barriers that are in place, cleansing the carts to reduce your risk. And you should limit, if you don't have to do something, you shouldn't be doing something. I mean, every time you go, you put yourself at some risk if you're indoors in a crowded space. As Rob had said, going outdoors and exercising, getting a good walk in has really no risk to that individual. In fact, it's very good for that individual. But you know, as you see compliance, the use of masks and the proper techniques of masks, hand washing, I, as a healthcare provider, observe it quite frequently when I go into stores, and I have changed my where I shop based on the fact as to how compliant those businesses are in protecting their staff and the people that the patrons that go to their stores.
Yeah, I think getting outdoors is really good for all of us right now. Our mental health has suffered significantly from the isolation and the early months that we were, really stuck indoors. And so the outdoor activities, as has been mentioned, are absolutely acceptable and good for us, good for our hearts and our souls. And then I think, as has been said too, adhering to, whenever you are indoors, though, really the source masking and social distancing are the best tools that we have to fight this virus right now.
Very good points, and appreciate the opportunity to be outside at this time of year. We have another minute for additional questions if anyone has one. Any final comments from our providers today?
I would just like to thank the media for being here and allow us to give this message and being partners with us in spreading this important public health announcement. We really need to do everything that we can and partner with other health systems as we have. This has really been a good time that I feel in medicine in the last 35 years that I've been doing this type of work. I've seen collaboration between healthcare providers, public health, businesses, schools, and our organizations to really do what's right for our communities, and that's a great thing.
Yes, thank you very much for the opportunity to get this message out there again. I think, like I've said, it's a relatively simple message, but it's a message that is currently the most effective way to deal with this. And unfortunately, we anticipate having to deal with this for a while yet, and hope that as we keep the message clear, and just to reiterate again, we are certainly not saying that masking is perfect, masking is easy, that masking will cure this infection, but it is effective at reducing it. And that conflicting messages that undermine, that masking doesn't do what it was supposed to do, I think are very difficult for people to interpret. So I think just a simple message that it's the best we have, and doing it is understood to be not a simple or not an easy thing to do, but it is relatively simple and effective. So thanks again for the opportunity. Hope that message will get out there.
Yeah, I appreciate the opportunity to be here today, and I would reiterate that it's not perfect, it's not comfortable, it's not fun, but it is the best thing that we have at this time to do the most good for the most amount of people in containing this virus and pandemic. So we are with you in it. I was wearing my mask as I sat down today, and I wear it all day long. So I promise it's not fun, but we got to do it. So thank you.
Well, thank you to that. Thank you for all of you for being here today. I did record today's session, so if any of the media would like a copy of that for their notes as they prepare any statements, please just reply to the original invite. Thank you all and have a great day.